Hello, my name is Rebecca, and I work for Pharmatech Oncology. During this video, I will speak to you about a type of cancer called lymphoma, and then tell you about a specific type of lymphoma called peripheral T-cell lymphoma. Lymphoma is a cancer of the immune system. The cancer starts with a type of white blood cell called lymphocytes. Lymphocytes can be found in the lymph nodes and other lymphoid tissues, like your spleen and thymus. Lymphoma is divided into two broad groups, Non-Hodgkins lymphoma and Hodgkin's lymphoma. There are over 67 types of lymphomas. Lymphoma is diagnosed in 4 stages based on the location within the body and if it's localized or widespread. Stage 1 means that the cancer is located only in one group of lymph nodes. Stage 2 means that the one group of lymph nodes are affected, but all affected lymph nodes will be in the same half of the body. Stage 3 means the cancer has spread to both the upper and lower parts of the body. Stage 4 means that lymphoma has moved to other organs besides the lymph nodes, for example, the lungs or the bone marrow. While scientists do not know the exact causes of non-Hodgkin's lymphoma, many types are thought to be linked to viral or retroviral infections, especially the common Asian HTLV1 virus. It is important to note that it is not caused by injury, nor is it caused by coming into contact with someone who has had the disease. Immunosuppression, which is when your immune system is suppressed, has been linked to the increase of developing lymphoma. Now let's talk about peripheral T-cell lymphoma, also known as PTCL. PTCL represents approximately 5 to 15% of all non-Hodgkin lymphomas in North America and Western Europe. PTCL is comprised of a group of rare and aggressive non-Hodgkin lymphomas that develop from T cells in different stages of maturity. Peripheral T-cell lymphoma generally affects people over the age of 60 and is diagnosed slightly more in men than women. Symptoms include lymph node swelling or lumps in the neck, groin, or armpit, fever greater than 100.4 Fahrenheit, unexplained weight loss greater than 10% of your body weight in 6 months, night sweats, and a loss of appetite. PTCL is usually discovered with stage 3 or 4 involvement and often has an aggressive clinical course requiring immediate treatment. To diagnose T-cell lymphoma, a small sample of your lymph node called a biopsy is drawn. This small sample or biopsy involves an operation, which is generally very small and can be done under a local anesthetic. The biopsy is then analyzed under a microscope and a diagnosis is made by a pathologist. Data from the surveillance, epidemiology, and end results registries suggest that from 1992 to 2005, the occurrence of PTCL increased nearly 3 times during those 13 years. PTCLs have been found to be slightly more common in males. Many types of PTCLs have a very low incidence rate in the United States, but are more common in areas of Asia. The prognoses, also known as the standard outcomes of patients with T-cell non-Hodgkin's lymphomas, of which PTCL is a subtype, are associated with a poorer outcome and survival compared to other lymphomas. Peripheral T-cell lymphoma is categorized as an aggressive disease, which means that it has a worse prognosis, but may respond to treatments better than non-aggressive group of lymphomas. The primary response rate for all PTCL subtypes remains at less than 60%, with nearly all patients experiencing relapse, where their cancer initially responds to treatment, but then progresses. Median survival for PTCL patients is approximately 3 to 4 years, with a 5-year survival rate of less than 30%. PTCL requires heavy treatment due to the aggressiveness of the cancer. PTCL is also a relatively rare cancer, and therefore only recently has treatment been approved for newly diagnosed PTCL, while still no standard treatment has been found for relapsed or refractory patients. Standard lymphoma treatments, however, may be effective. These include chemotherapy, which uses anti-cancer or cytotoxic drugs to destroy cancer cells. It is the usual treatment for peripheral T-cell lymphoma. It can be quite difficult to treat successfully, although some people are cured by chemotherapy. In others, chemotherapy can often reduce and control the cancer for a period of time. Steroid drugs are often used with chemotherapy in order to reduce common side effects, including nausea and vomiting. Radiotherapy uses high-energy rays to destroy cancer cells and sparing the healthy cells. If the lymphoma is a stage 1 or 2, which means it affects the lymph nodes in only one area of the body, a combination of chemotherapy and radiotherapy may be used. With bone marrow transplant or stem cell transplant procedures, chemotherapy and radiation first destroy cancer and normal lymphatic cells, and transplant procedures then infuse the body with non-cancerous new stem cells, the cells that are the precursor to the lymphatic system. However, this is limited only to selected patients since the side effect of this highly aggressive treatment is commonly intolerable to some patients. For most subtypes of peripheral T-cell lymphoma, the initial treatment regimen is typically CHOP-based chemotherapy or EPOCH, although it has been found that chemotherapy is effective only when restricted to patients with a favorable prognosis. Secondary treatments for relapsed PTCL patients include ICE followed by stem cell transplant. There are no treatments approved for standard therapy specifically for relapsed PTCL. Patients should consider participation in clinical trials as a treatment option. Only through patients taking part in clinical trials will treatments specifically for PTCL be proven to increase patient survival. Several new drugs are being studied in clinical trials and show promising results in the treatment of some types of PTCL. For example, HDAC inhibitors, a new class of chemotherapy, have produced encouraging responses among patients with PTCL. 2 of 11 PTCL patients treated with the HDAC inhibitor belanostat in a phase 2 study achieved complete response, and 5 patients had stable disease. Although strides have been made in the treatment of PTCLs, more research is necessary, especially for patients with advanced and relapsed or refractory disease. Therapies tailored specifically for patients with PTCLs do not exist currently. It is essential that doctors encourage patients to participate in such trials to help advance the knowledge and improve outcomes for these incurable forms of lymphoma. We currently have an open study for peripheral T-cell lymphoma. Please visit pharmatechOncology.com for more information.